My project is a combination of my passions for rheumatology and global health. I had done a lot of previous work prior to my rheumatology training in South America and Africa. And as I grew to learn more about lupus, I learned that lupus is often more severe in patients of African extraction. However, there's very little known about lupus in Africa. I have been living in South Africa for the past almost 18 months now, and during that time we just began collecting all the patients who were diagnosed with lupus prior to the age of 18, and started to doing a chart review, collecting, presenting information, what clinical features, serological markers, things that brought them to care, and then compared them to a similarly matched cohort of pediatric lupus patients from North America to see if they have more severe disease, if they present similarly or differently. So I think it's an important question to really explore if the differences that we see in patients of African extraction from the United States and Europe, if those differences are based on genetic factors or socioeconomic factors or environmental factors or a combination of all three of those things. So in the initial studies, it looks like our patient cohort has very severe disease at presentation. They often present with high rates of lupus nephritis, and their lupus nephritis is of the more severe category. There's potential to figure out if there are certain subpopulations of pediatric lupus patients or lupus patients that are more at risk for certain types of disease based on race, or that should be treated with certain treatments based on their ancestry. So kind of risk factors for severe disease and also most effective treatments are some of the questions that we're hoping to answer with this study. One really exciting part of this study is that just describing kind of the clinical and demographic features of the population has been kind of the first step in establishing who these patients are, what do they look like, are they the same or different, but really kind of continuing to develop this cohort and asking questions like, are their genetics different, are their antibody profiles different, are their markers of lupus activity different would be really exciting. And then I think, other things that we've kind of been looking at in addition to the clinical and serologic markers are access to care and how that affects diagnosis and treatment outcomes. And I think that's also applicable to patients with lupus throughout the world, not just in our setting.